Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute. In this today's session or today lecture, we are going to cover anti-epileptic drugs part 1. In this lecture, we are going to cover about what is an epilepsy and what are the types of epilepsy, and we will see the classification of anti-epileptic drugs. So, without any further delay, we will move into this today's session. So, what is an epilepsy? So, before going to the in detail topic, let me know about what is an epilepsy. Epilepsy is termed as it is a chronic disorder. Which type of disorder? It is a central nervous system disorder, it is a CNS disorder, it is a CNS disorder, especially if I am talking about this epilepsy, it is a chronic disease. It is a chronic disease produces by the changes in electrical impulse of the brain. So, if there is any electrical function, if any disturbance in electrical function, then this chronic disorder will be seen like epilepsy. So, what is the epilepsy is characterized by? How the epilepsy is characterized? The epilepsy is characterized by disturbance of consciousness in sense disturbances of any seizures or with or without characteristics movement. Sometimes you can see sometimes you can observe the body movement, sometimes you cannot observe the body movements. So, these are the things which are characterized with the epilepsy. And what is the major difference between the epilepsy and seizures? Almost both are similar, but they having a little bit difference with these terminologies, seizures and epilepsy. If I am talking about seizures, the seizure it means abnormal discharge of any single neuron or any particular neuron, not a single, it any particular. If I am talking about any particular neuron, if you are seeing any abnormal discharge of any particular neuron, then if it happened continuously, then it is called as an epilepsy. If there is any abnormal discharge of a particular neuron, then you can call it as an seizures, and this abnormal discharge is happening continuously in our body, then it can called as an epilepsy. Okay. So, if a particular person who having the seizures, what the things you have to do and what the things you should not do. So, the things you have to do, first you have to keep away from the surroundings like the people. So, first if you see, you keep the peoples out, keep other people. So, if you are seeing any person having the convulsions or epilepsy, you have to keep the other peoples away from that convulsive patient, okay, and clear the dangerous objects which are present nearby the patient. If the nearby the patient, if you have found any dangerous objects, you have to clear that dangerous objects from the particular patient. Time of the seizure, you have to note at which time the seizures has been you had been noticed, right. The time is also an important factor you have to notice here. And cushion his head, you have to keep somewhat pillow or whatever it may be, you have to keep the cushion his head, right. And the roll the person on his side. If the person is in a straight upright position, you have to just roll the particular person on the side way. Okay. Stay and reassure, you have to stay and you have to reassure and call the medical help. This is the very important thing you have to do. When you had seen any particular epilepsy patient on the road, then what you have to do here, first you have to call the medical help, right, and regaining consciousness, you have regaining consciousness. And this is the very important thing, what the things you should not do when the particular person having the epilepsy, what the things you should not give. So, you should not be panic, first you should not be panic, right, and after of that you should not restrain the movements, you should not forcefully, you should not restrain the movements, okay, and you should not put anything in the mouth. So, whatever it may be, you should not put anything inside the convulsive patient. This is the things what you have to do and what you should not do. Okay, and types of seizures, the seizures has been classified into mainly two types: simple seizures, partial seizures, generalized seizures and partial seizures, right. And this is the first picture you can see, it is a healthy brain. So, there will be no seizures you can found here. And if I am talking about the focal seizure, so here you can see somewhat red in position. So, this is a focal seizures which will seen in a single part of a brain, right. And what about the generalized seizure? This is a generalized seizure or generalized epilepsy, it will be spread throughout the brain, the seizures will be spread throughout the brain. So, this is the major difference between the focal seizure and the generalized seizures. And next we will discuss about the types of seizures. So, the seizures has been classified mainly into two types. What are the generalized seizures and second one is partial seizures. If I am talking about the generalized seizure is further classified into tonic-clonic, tonic seizures, atonic seizures, absence seizures, myoclonic seizures and infantile seizures. All these seizures comes under generalized seizures. And what about the partial seizures? Partial seizures also further classified into simple partial seizure, complex partial seizure and secondary generalized partial seizure. So, these are the types of seizures which you can see here. So, the seizures has been classified into mainly two categories. What are they? Generalized seizures and partial seizures. In generalized seizures, you can see the tonic, clonic, tonic, atonic, absence, myoclonic and infantile. So, here you had seen the terminologies like tonic, clonic, tonic. What is meant by tonic? What is meant by clonic? If the person having the tonic represent here the person will become rigid. So, this person will become rigid. The tonic, it represents the person having the rigid position, right? And what is meant by clonic? Uncontrolled jerkins. If you are seeing the particular person having uncontrolled jerkins, then you can term it as a clonic seizure. Okay? And we will discuss one by one seizures in details in the next slides, right? And what about the partial seizures? Partial seizures has been further classified into simple, complex and secondary generalized seizures. So, we will move to the first seizure, tonic clonic seizure. Tonic clonic seizure is a generalized seizure. It comes under generalized seizure. Just now I had said you what is mean by tonic, what is mean by clonic. Tonic in sense it represents the body will become rigid. Clonic, what is mean by clonic? Clonic you have see the uncontrolled jerkins. So, what is a tonic clonic seizures? And before going to this particular topic, we will see about what the next name for the tonic clonic seizure. So, the tonic clonic seizure you also called as a grand mal epilepsy. This is the next name for the tonic clonic seizure. So, the tonic clonic seizure is also called as a grand mal epilepsy, and this attack is accompanied by the tongue biting. So, how can you recognize a particular person having the tonic clonic seizure? You can recognize if the person having the tongue biting, it is accompanied by the tongue biting. So, this is one of the symptoms you can observe with the tonic clonic seizures. At the tonic clonic seizure are characterized by the sudden loss of consciousness without any warning. Here the person will causes the loss of consciousness, but without any warning. So, if any person having the tonic clonic seizures, here the person will lose this consciousness without any warning, and which is followed by tonic, the body will become rigid, and next it is followed with the clonic, uncontrolled jerkins you will be seen. And when the person having the uncontrolled jerkins, you can see like you can observe the particular person having headache, confusion, and the person may go to the sleep also. This is about the grand mal epilepsy. We will discuss the next seizure. Okay, next seizure is called as a tonic seizure. The tonic seizure is almost same that of a tonic clonic seizure, but the only difference was in tonic seizure you cannot see the clonic phase. The only tonic phase will be seen in the tonic seizures. So, in the tonic seizures the same, it is accompanied by the tongue biting. It is produces the loss of consciousness without any warning here, and which is followed by the tonic. Here the body will become rigid, and in this seizure, in particular this seizure, you cannot see any clonic phase. There will be no clonic phase here, right. So, this is called the tonic seizures. And what about atonic seizures? Atonic seizures are also called as a drop attack seizures. Suddenly the person will drop on the floor. This is the reason why you can call this as a drop attack seizures. So, atonic seizures is also called as a drop attack seizure. Here the person, when you had observed the particular person, you can see like a loss of postural tone and no tonic and clonic movements will be seen. Here you cannot observe any rigid of the body, you cannot observe any uncontrolled jerking. There will be no tonic and clonic phases you can see with these atonic seizures. But what you can observe here, we can observe the loss of postural tone. So, particular person postural tone will be get lost. So, this is called as an atonic seizures, and here the head may drop for a few seconds. If the child having, or if any child having the atonic seizure, he may fall on the floor. So, this is the recognition that particular person having the atonic seizures. So, in particular these seizures you can see the damage of brain. So, this is about the atonic seizures. Atonic seizures are also called as a drop attack seizures. This is accompanied, or this is characterized by the loss of postural tone without tonic and clonic phase, and at these seizures what is going to happen here, the head may be dropped for a few seconds. Here the particular person who having the atonic seizures, he will drop his head for a particular second, and if child having the atonic seizure, he or she may fall on the floor. and these seizures may causes the brain damage. So, who having these atonic seizures, the particular person will causes the brain damage. And next seizure was absence seizures. Absence seizure is also called as an akinetic epilepsy or akinetic seizures. So, what is seen here? Absence seizure, what absence in this seizure? What is going to absence in this seizure? It is suddenly occurs without any convulsive movements, without any loss of postural sound. If you are observing this absence seizure, the name itself having absence. So, something is going to absent. What is going to absence here? In this particular seizure, you can see there will be no postural tone, no loss of postural tone, no loss of consciousness. In particular seizure, suddenly it will occurs without any convulsive movements or without any loss of postural tone. At this condition, at this absence seizure, what is going to happen? The patient will go blank for a few seconds, and the particular patient cannot understand what thing happened with him. Right, because the seizures will happen very few seconds. This is the seizures which will happen for a few seconds, where the particular person will go blank for a few seconds. Why he go blank for a few seconds to a minute? Because the patient don't know what happened with him or her. Because of these few seconds, the person will come normal position very soon, right. And in this absence seizure, you can see the blinking of eyelids. So, what is the main thing you can observe here? The blinking of eyelids is one of the thing you can observe in the absence seizure. Blinking of eyelids and the small chewing movements is been observed in the absence seizure. If I am talking about the tonic-clonic seizure and tonic seizures, you can see the tongue biting, but in absence seizure you can observe the chewing movements, or you can see the blinking of eyelids, right. And these seizures always begins in childhood. So, this absence seizure always begins in the childhood. So, absence seizures are also named as akinetic seizures, and these are the seizures which will happen very suddenly and without any convulsive movements or without loss of postural zone. And due to because of suddenly and sudden portion, the particular person will go blank for a few seconds to minutes, and the particular person do not know what thing happened with him or her. So, due to because of these few seconds, the person will come back to the normal position as soon as possible. But at this condition, at this absence seizure, you can see the blinking of eyes or chewing movements of a particular patient, and these seizures will be seen on the childhood. So, it will be normally these seizures will begin at the childhood. And what is the next seizure? Myoclonic seizures. This is the last seizure in your generalized seizures, right. And myoclonic seizures, it is a sudden repetitive muscle contraction. If you see any repetitive muscle contraction, if it is happening suddenly, then you can call as a myoclonic seizures. Myoclonic seizures, it may causes a whole body or any part of a body. So, myoclonic seizure will happen in any part of a body, or it can causes the entire whole body. So, this is a myoclonic seizures. In myoclonic seizures may occurs by the themselves, or it will occurs with the other seizures. So, the myoclonic can occurs in a single, or it can occurs or it can exist with the other seizures. So, this is about myoclonic seizures. So, if I am talking about these seizures, I had said you the generalized seizures has been classified into tonic-clonic. I had explained you what is a tonic-clonic, and after that we had discussed about the tonic, and after that we had discussed about the atonic and absence, myoclonic and infantile. And what about the partial seizures? Partial seizures has been classified into simple, complex and secondary generalized seizures. What are the simple partial seizures? In simple partial seizure, here the seizures will be seen on the single part of a brain. Here no loss of memory. Here normally you cannot see any loss of memory in this particular simple seizure. Okay? And this will be seen only single part of any brain. Right, this is called as a simple seizure, and simple seizure will be seen on the cortical portion or cortical lobe, and where you will see this one, you will see this one on the cortical lobe, right. These seizures will be seen on the cortical lobe. And what about the complex seizures? The name itself having complex seizures, it will seen on the not only one part, you can see in the most of the parts of a brain, and here you will see the loss of memory also. Loss of memory is one of the thing you can observe with the complex seizure, and in which part it is going to happen? It will happen on the temporal lobe. If I am talking about the simple seizure, it happens on the cortical lobe, right. And what about the complex seizure? The complex seizure will be happened on the, in which part? It will happen on the temporal lobe. This one is a cortical lobe, this one in the temporal lobe. They do not cause us loss of memory, it will cause us the loss of memory. And in simple seizure, it will occur on a single part of a brain, it will occur the almost most of the parts of a brain. And secondary generalized seizure, secondary generalized partial seizure, where you can see the tonic-clonic like seizures. So, this is about the entire seizures. Okay. The entire seizures we had discussed in detail what is a generalized seizures and what is a partial seizures. Okay, now we will move to the classification of an anti-seizure drugs. So, after completion of these generalized seizures and partial seizures, we will move into the classification. So, what is the difference between the seizures and epilepsy? I had said you in the first slide, the seizures, if any abnormal discharge of a particular neuron, you can call it as an seizures, and if it happening continuously, then you can call it as an epilepsy. So, what is the difference between these drugs? These drugs has been classified, anti-seizure drugs has been classified into mainly two types, anticonvulsant drugs and anti-epileptic drugs. So, what is the difference between the anticonvulsant drugs and anti-epileptic drugs? Anticonvulsant drugs are the drugs which will abolish the seizures. Okay, are you getting the point? What is the difference between the anticonvulsant drugs and anti-epileptic drugs? Anticonvulsant drugs and anti-epileptic drugs are going to give to treat the seizures. To treat the seizures, we can advise the anticonvulsant drugs or anti-epileptic drugs. What is the major difference between the anticonvulsant drugs and anti-epileptic drugs? If I am talking about the anticonvulsant drugs, these are the drugs going to abolish the seizures. And what about the anti-epileptic drugs? Anti-epileptics are the drugs which acts as a prophylactic. It can prevent the seizures. One drug like convulsant drugs, anticonvulsant drugs will abolish the seizures, and anti-epileptic drugs will prevent the seizures. This is the major difference between the anticonvulsant drugs and anti-epileptic drugs. If I am talking about these anti-seizures drugs, it has been classified into central acting drugs, drugs acting on spinal cord and skeleton muscle relaxants. So, these anti-seizures drugs has been categorized into mainly three types. What are the central acting drugs, and second one is drugs acting on spinal cord, and third one is skeleton muscle relaxants. So, which drugs falls under central acting drugs? The best examples are diazepams and barbiturates. Benzodiazepines and barbiturates will falls under central acting drugs. And what about drugs acting on spinal cords? Mefenicine, central acting muscle relaxant. We had discussed in the previous lecture central acting muscle relaxant. Mefenicine is a central acting muscle relaxant, right. So, these are the drugs. Mefenicine is a drug which acts on spinal cord. And the next one, skeleton muscle relaxants. Even you can use the skeleton muscle relaxants to treat the seizures. So, what are the skeleton muscle relaxants? You can use here D-tuberculin and succinylcholine. What type of drugs these are? D-tuberculin and succinylcholine. One drug is a depolarizing drug and second one is a non-depolarizing drug. Which one is a non-depolarizing? So, D-tuberculin is a non-depolarizing, right. And what about succinylcholine? Succinylcholine is a depolarizing drug. It is a derivative to the somewhat related to the acetylcholine. First, it will causes the depolarization, it will sensitize the neuron and it will causes the muscle relaxant activity. So, you can use the both drugs like D-tuberculin and succinylcholine to treat the skeleton muscle relaxant, or these are the drugs which are used in the seizures as well. And the next one, classification of anti-epileptic drugs according to its mechanism of action. Here the point you have to remember, according to its mode of action, these are the drugs going to classify, right. So, according to the mode of action, how the drugs has been classified? The drugs has been classified here mainly 8 types. What are the 8 types of drugs here? One is hydantoin derivative, second one is benzodiazepines. Benzodiazepines are also drugs which can use it to the use it in epilepsy. You can use the barbiturate drugs, you can use the immunostimulants drugs, you can use the succinamide drugs, you can use the aliphatic carboxylic acid drugs, you can use the GABA agonist drugs, and there are some newer drugs which are used to treat the epilepsy. So, these are all the drugs which are used in the epilepsy. We will discuss one by one what is the example comes here. Okay, first one is Haydn-Toyn derivative. So, Haydn-Toyn derivative. So, what is an Haydn-Toyn derivative here? Phenytoin. Phenytoin is the best drug or standard drug to treat the epilepsy. Phenytoin and fosphenytoin, these are the drugs which falls under Haydn-Toyn derivative, right. And what is the second one? Benzodiazepines. Benzodiazepines are such a drugs which can be used as an skeletal muscle relaxant peripherally, which can use it as an skeletal muscle relaxant centrally, it can used as an sedative drug, it can used as an hypnotic drug, it can used in the epilepsy. So, these are the drugs you can having the very wide therapeutic uses in the pharmacology, right. So, benzodiazepines, here what the benzodiazepines we are going to use here? Clonazepam, diazepam and lorazepam. So, these are the drugs you are going to use to treat the epilepsy. And next one is barbiturate. So, which barbiturate you are going to use here? Phenobarbital, deoxybarbital. So, these are the drugs which are going to use to treat the epilepsy. And next one, immunostimulants. Immunostimulants like a carbazepine and oxcarbazepine. So, these are the drugs which falls under immunostimulants. These are the drugs used to treat the epilepsy. Next one, succinamide. So, which succinamide you are going to use to treat the epilepsy? Ethosuxcinamide. Ethosuxcinamide is a drug which can use it to treat the epilepsy. And next one, aliphatic carboxylic acid. So, which aliphatic carboxylic acid you are going to use here? Sodium valproate and divalproex. Okay, these are the drugs which can use it to treat the epilepsy. And you can use the GABA agonist or GABA analog drugs like gabapentin. It will enhances the GABA action, it will enhances the GABAergic action. So, these are the drugs you can use it. There are newer drugs also which are used to treat the epilepsy. The newer drugs are vigabatrin, topiramate and zonisamide. Okay, what are the drugs? Vigabatrin, topiramate and zonisamide. So, these are the newer drugs which are used to treat the epilepsy. So, what are the drugs going to use in epilepsy? There are a lot of drugs like benzodiazepines, barbiturates, aliphatic compounds, and you can use the immunostimulants, you can use the succinamide drugs, you can use the Haydn-Toyn derivatives, newer drugs, GABA agonist drugs. All these are the drugs which are used to treat the epilepsy. So, if you are talking about these classification of anti-epileptic drugs, all these are drugs which are used to treat the epilepsy. For some of the drugs will concentrate on sodium channel, some of the drugs will concentrate to block the calcium channel, some of the drugs will increases the GABAergic action, or some of the few drugs will decreases the glutamate action. All these are the drugs which will shows the anti-epileptic in action. If I am talking about these drugs, what is the main reason about this epilepsy? So, if I am talking about this epilepsy, the major reason with the neurotransmitter like glutamate. So, we know that the glutamate is an excitatory neurotransmitter. So, this excitatory neurotransmitter, when it releases from the presynaptic neuron to the synaptic cleft, it will go and bind to its receptors. After go and bind to its receptor, what is going to happen here? It will bind to its receptors, and what are the receptors for glutamate? NMDA receptor and AMPA receptor. When it bind to these receptors, there will be the opening of sodium channels and the opening of calcium channels, and opening of these both channels will the most positivity will enter into the cell, and which may causes the depolarization, and which will causes some depolarization. What will happens when the cell having depolarization, and if the excess level of glutamate has been released in your body, which may causes more depolarization, and this excitation of the cell will pass the spread to the next neuron, and this will happens continuously, which will leads to the epilepsy. So, we will discuss in the next class with entire examples. Thank you.